Good morning. I'm Dr. Shindana Fagans, and you are watching House Calls, where we come to you through television addressing the health issues that affect you, your family, and the community. Today we have Dr. Alicia Hall. She is a physician here in Nashville. Her specialty is in family medicine, a graduate of my alma mater, Meharry Medical College. So we are so excited to have you here this morning, Dr. Hall.
I'm so glad to be here, Dr. Fagans. Thank you for having me.
Now, you have a medical practice here in Nashville. It's called Advanced Care Centers.
That's correct, yes.
Tell us about Advanced Care Centers, how long it's been established,
Yes.
and give us a little information about it.
Yes, well, Advanced Care Centers has been established for almost a decade now. We started back in 2004, and we are located here in Nashville, Tennessee. Our parent clinic we have a second location in the Jeffersonville, Indiana area, Louisville, Kentucky area.
Oh, wow. Okay.
Kentuckiana, as they call it. And what we do, we actually specialize in rectal problems such as hemorrhoids, and we offer non-invasive treatments for hemorrhoids so people don't have to have surgery.
Now, I know what hemorrhoids are, but not everyone knows what a hemorrhoid is. So tell us, what are hemorrhoids and what are some of the signs and symptoms of hemorrhoids?
Yes, well, all a hemorrhoid is just an enlarged, swollen vein, similar to varicose veins in the legs, but they occur in the rectum.
Okay.
And so that's what they are.
Are they painful, or can they be painful?
They can be. If they can cause burning and itching and pain and bleeding and a lot of discomfort and disruption of people's lifestyles.
Okay. So you do a procedure at your office. It's called IRC. Tell us what IRC is and what that acronym stands for.
Okay, so IRC is infrared coagulation. It's similar to a laser treatment in that it's a light heat energy source. It's just a whole lot more gentle.
Okay.
And so we use this procedure to actually coagulate hemorrhoid veins, and that destroys them and causes the hemorrhoids to shrink and go away.
So is it a painless procedure?
That is the beauty of this treatment. It's gentle and it's pain-free.
Are there any side effects with the procedure?
With the procedure, there may be some pressure in the rectum after the procedure, but it's a very quick, simple, painless procedure done right in the office. Only takes a few seconds. People can go back to work the same day. There's no downtime or a recovery period. They don't have to take away time from work or family.
Okay.
So that's the beauty of it.
Well, that sounds good. So we're going to go to a commercial break, and we will come back and talk more about IRC. Welcome back to House Calls. I'm Dr. Shindana Fagans. Before the commercial break, we were talking to Dr. Alicia Hall about the IRC procedure, which is infrared coagulation. Dr. Hall, so what should a person expect on their first visit, and how long should they expect to be there for that visit?
So on a first visit, first of all, they're going to be greeted by a very warm, open, and friendly staff, very professional and confidential. They will get a thorough history and examination to make sure they're a candidate for the treatment. And if they are, we actually do treatments on the very first day of consultation.
Now, what makes a person a candidate for the treatment? Can you briefly tell us that?
Yes. Well, there are different types of hemorrhoids, and we treat internal hemorrhoids directly. And so if they have symptoms like bleeding, pain, itching, have issues with constipation, then and we see that they actually have internal hemorrhoids, then that makes them a candidate for the treatment.
Great. How many treatments are required for the procedure?
On average, most people require anywhere from 4 to 8 treatments, and treatments are 2 weeks apart.
And does insurance cover the procedure? Because that's a very important question.
Yes, it is,
Okay.
and thankfully, yes. Most major insurances cover the procedure.
Now, how effective are those treatments, and how long does the treatment last?
The great part about this procedure is that 95% of people who have it do not have to have surgery.
Great.
So it's highly effective, and they last for years. On clinical experience, at least 4 years, but they may never come back. It just depends on a person's lifestyle and risk factors.
So if someone wants to get in touch with you, what's the best way for them to reach you?
Our phone number is 615-329-7969, And if they just call, the staff that's there will definitely schedule them in.
Great. So well, it was great having you on the show, Dr. Hall. We'll have to have you back again another time.
Yeah.
Is there any last thoughts that you would like to leave, for example, regarding colonoscopy screening?
Yes,
Because I know that's
yes.
very important.
Well, first of all, every person should get a colonoscopy screening by age 50. It's life-saving. It's one of our most cost-effective screens. 60% of colon cancer deaths can actually be prevented if they had their colonoscopy.
Wow.
And they were treated early for any polyp or any other situation that was found. But for those that have bleeding, pain, itching, or other issues having going to the restroom, most times it's due to hemorrhoids.
Okay.
And so please come and get something done. You should not suffer and sit in silence there. You can have something done that's pain-free, non-surgical, and very effective.
Well, great. And insurance covers it. So, hey,
Yes.
call Dr. Alicia Hall, and if you have any of those symptoms that were discussed on the show, and we will see you next time on House Calls. Don't miss your house call.